As the COVID-19 crisis threatens the global economy with recession, industry from across sectors must prepare for a spectrum of possible scenarios and economic repercussions. A look at trends in healthcare spending following the 2008 financial crisis can provide some hints as to what the pharmaceutical industry may face if the downturn becomes a full-blown recession. While there are many unknowns ahead, experience suggests that a recession would lead to government measures to limit spending, which would likely impact healthcare budgets. In the years after 2008, budgets across Europe were capped as governments attempted to rein in spending as part of broader efforts to reduce escalating budgetary deficits. There are two major trends the pharmaceutical industry should keep in mind from the years following the financial crisis. Healthcare spending slowed significantly. From 2005 to 2009, health spending experienced an annual per capita growth of 3.1%. This dropped to 0.7% following the crisis. While this slowly increased in the years after, it was at a slower rate compared to pre-crisis period and more in line with economic growth, which was limited. This in turn affected spending on pharmaceuticals, which is the third largest expenditure within healthcare spending after inpatient and outpatient care. After undergoing an annual increase of 1.4% per capita prior to the crisis, expenditure on pharmaceuticals dropped to negative 1.1% on average in the EU, mainly triggered by cuts in public spending. Overall, the average annual growth rates from 2009 to 2014 remain much lower than pre-crisis levels. These trends reflect restricted healthcare budgets, in which there were limited resources to finance new, innovative medicines. In light of these limitations, there was a greater role for considerations of economic value and affordability of a product prior to its authorization for use in EU markets. The successful uptake of a new medicine depended on its capacity to demonstrate value to all stakeholders and regulatory agencies, HTA bodies, prescribers, and patients. While it is possible that the economy will recover more swiftly than it did after 2008, we should anticipate healthcare spending will be capped during a period of limited economic growth. It could be possible that following a global health crisis, governments would opt to bolster health budgets rather than reduce them, but it is uncertain if added resources post-COVID-19 would go to existing health issues such as rare or chronic diseases. For the pharmaceutical industry, this will increase the necessity to effectively demonstrate value of a product through stakeholder relations and environment shaping prior to authorization and launch.